Hello, this is Amir, Hematology Registrar. Welcome back in the channel Let's Bleep Haematology. Our today's topic is high ferritin level, where the main worry is whether this is HLH related or something else. HLH is hemophagocytic lymphohistiocytosis, very difficult name. Even hematologists struggle to take the full name. So it is called HLH in a simple word. So ferritin is an inflammatory marker. It will be high in any infectious state and any inflammatory state. So if a patient has sepsis, DIC, or infection, if you check their ferritin level, it will be high. If a patient has any autoimmune disease or exacerbation of any autoimmune disease, the ferritin level would be high as well. A patient with deranged liver function, alcohol related injury, non alcohol related injury, if you check their ferritin level would be high as well. If a patient has renal problem, there will be decreased secretion or excretion of ferritin level will be high in the patient blood as well. Storage disorders in the pediatric population, their ferritin level will be high as well. So there are multiple secondary causes of a high ferritin, but from the hematology side, there are also few causes of high ferritin, like transfusion dependency, hematological disorders like plastic anemia, myelodysplastic syndrome, etc. If a patient has ineffective erythropoiesis, like thalassemias, sickle cell anemias, their ferritin level will be high. If a patient has HLH, then yes, ferritin level will be high. So the main worry when we receive referrals from other team is whether this patient has HLH or not, because untreated HLH has high mortality. So this is the main worry. So HLH in general condition, if someone has infection, inflammation, or liver injury, it will be high, but it will be like 1000, 1200, not more than that. But if the ferritin level is 5,000, 10,000, 20,000, then you cannot ignore that. Then you have to ring the hematologist, bleep the hematologist, or alert the hematologist that whether this is HLH related or not. Remember 3F formula for the HLH. First F is fever, but that fever should be persistent, resistant to different antibiotics. Patient has used two two courses of antibiotics, three courses of antibiotics, but the patient is still spiking every day. This is a 1F of the HLH. Second is falling counts. If a patient is cytopenic or HB is going down, there is no other cause. White cell count is going down, no other cause. The neutrophil count is going down, and or the platelet count is going down. Um, this is a second F. So fever, persistent fever, resistant to antibiotic, plus falling counts, and then ferritin. And this ferritin is in thousands, 15,000, 20,000. We have seen patients where the HLH is the HLH was 82,000 and 90,000 recently in our patient. Then you should be thinking about to contact the hematology. This is the real indication of referral to hematologist, and the hematologist will act accordingly according to the guidelines. There are existing guidelines for HLH, which include calculation of HLH score that include close fibrinogen, triglyceride levels, AST in the patient, the ferritin levels in the patient, and bone marrow biopsies as well. So the hematology will give their input, whether it is primary or secondary. Some of the secondary causes are hematology related as well, like secondary to stem cell transplant, secondary to lymphoma. These comes under hematology. But if it is because of the rheumatoid arthritis, for example, or any rheumatological reasons, then or infection related, then hematology usually do not take over such patients because of these secondary causes, which can be dealt in other wards. So, a high ferritin does not always mean that this is HLH disease or HLH syndrome. There are multiple secondary causes of high ferritin, any infection, any inflammation, any liver injury, any renal abnormality, or solid organ cancer even can lead to high ferritin as well. In these cases, they are temporary. When the secondary cause is over, the patient ferritin level will go down. If a patient is thalassemic, have sideroblastic anemia, or transfusion dependent, or any other cause of ineffective erythropoiesis, their ferritin level will be high as well. The main worry is when there is hyperferritinemia and the ferritin count is in thousands, 10,000, 15,000, 20,000, plus patient has resistant fever, not responding to any antibiotic, plus falling counts. HB was normal 2 months ago, but since admissions, the count is decreasing, platelet count is decreasing, white cell count is decreasing. This means that this patient has a hemophagocytosis going on in the bone marrow that need to be investigated, and hematologists need to be involved to find out whether this patient need HLH treatment in the form of steroids, anakinra, etc. or not. Okay. So, if you have any question about high ferritin, please write it in the comments. I'm happy to answer, and thank you very much.